This is impressive. I think my mom would be impressed, but she's going to have to look down from above. So, my name's Neil Rollins. I'm an OBGYN doc, but I got into this because I had a son that tried to die on me and so forth. So, what I'm giving you today is kind of the how, what things you can take to help with certain things. I give a little longer talk sometimes that talks about more of the research behind it and so forth. And I'll go over that some, but your handout has additional things that I'm not necessarily going to talk about today, and it's also got a copy of one of my talks that I give. I started giving these talks in February of 2007, so this is starting my 13th year, thinking that I'd give this talk for a few years and everybody would have heard me and then we'd be fine. But it turns out that I keep having people show up, so I keep giving it. So what I want to do today is go over some of the common things for which we now know we can treat with some nutritional supplements that are not always real cheap, but they're over the counter and readily available. So we're hoping that I can get through this. I ask you wait or hold your questions till the end, and I'm sure I won't get to everybody's questions in the allotted time, but in order to get through all the information with this big of a group, I think we'll need to wait for the questions at the end. So the things that I'm talking about are really about nerves. And so if we can improve the nerve function, it will improve our memory, our depression, nerve pain, and it also improves healing both of nerves and of wounds. And those things were all studied and went through the FDA back in 2006. And we had pretty good data then. We've got really good data now. So, memory. Okay, I love this quote. You ever feel this way? The problem is that most of my grandkids have no idea what we're talking about here, right? Camera, it's got an SD card, not film, but sometimes we start to struggle with our memory, and that doesn't necessarily need to be with aging. And especially a number of the toxins that we're exposed to cause that problem as well. So some of these treatments I'm going to talk about are really common to all of these things because we're talking about nerve healing. And you know, some of the members of my family, they all joke about, well, you're all always talking about the same thing and you think it helps with everything. And it's like, well, the reality is this is a process that is important to every aspect of your health. And so in many respects, it's kind of one common pathway that affects almost every process in your body. So the first thing is that folic acid we've known has been critical. But until the Human Genome Project, we didn't understand how important it was to get it into the right form. That I can give you a can of soup, and it's got nutrition in there. But if I don't give you a can opener, you can't get that nutrition into your body. And that's what we're talking about. You can get folic acid, but if you can't process it, it doesn't do you any good. B12 is another one that has been studied for decades that helps with nerve healing. But it is paired with the folate, and it also has to be active, and it's got to be absorbed, and it doesn't absorb as well as we'd like. And so the part of why we go to the oral dissolving tablet is it bypasses the complex absorption. And then the third thing is vitamin B6, which is another one that has to be processed and become in the active form to be useful. And it's a kind of a special one because it's the one B vitamin that in a small percentage of the population can build up and cause problems. So you have to be a little careful with it. And then the fourth thing is not a vitamin. It's a protein component or an amino acid. But it's an essential amino acid, meaning your body can't make it. And it's one that has some really fascinating data. Okay, so I tell my kids, little things please little minds, and here's an amino acid, and I find it fascinating. Hopefully at the end of this you'll find it fascinating too. So what they found in numerous studies, but this is one that illustrates it well, is that the methylfolate has got to get into your brain. And that, the CNS, I realized I tried to spell all these acronyms out and I missed some. CNS is your central nervous system or your brain. Well, if you've got folic acid in your bloodstream, it can be sky high and not get enough into your brain. But if you don't have enough in your brain, then you don't heal. You can't make your serotonin, dopamine, norepinephrine. You damage your DNA, which ends up increasing your aging process or shortening your life. And you can damage your blood vessels, which is what causes the nerves to die off in diabetics and causes huge symptoms with nerve pain, loss of sensation, those kinds of things. So it all stems from not getting enough of the methylfolate in your brain. And that can be that you're just being starved to death. These are studies from World War II and in China where they starved people to death. And then it can be genetic, and that's what the MTHFR is. It's a genetic defect. And this was the first treatment that came out of the Human Genome Project, first genetic treatment that came out. Or it can be induced by a lot of the toxins that we talk about. Turns out that you hear all the time that BPA, the plastic stuff, is bad, right? But they never tell you why. Well, I'm going to tell you why. It's because it blocks this same pathway and affects all of this. So memory loss. So it turns out that memory loss has been a concern for all of us, and quite honestly seems to be getting worse. And so they did some studies looking at the three out of the four things I was talking about, the methylfolate, the methyl B12, and the N-acetylcysteine. And it went through the FDA with just memory studies, okay? How good's your memory and all of that. But the argument was, well, my memory's better in the morning than the afternoon, so they were more subjective. So they did a vitamin study, a study with this, and they called it the VitaCog study, or vitamin cognition. I think they have a budget item for the marketing people to name these studies. But anyway, so as a 2-year study, they took 70-year-olds and they did imaging of the brain to see how big their brain was. And then they looked at the brain 2 years later. And then they did one of those computer things that says, how much brain did you lose? And this shows you, on the left is the people that took these 2 vitamins in their special form and the amino acid. They lost less than 1% of their gray matter. In the group that didn't take it, they lost about half of their gray matter in those 2 years. And I'm like, okay, so these things are water soluble. If I get too much, I pee it off. And My worst case is expensive urine because we don't know exactly how much you need for this preservation. But my best case is, I get to keep my brain? Yeah, I'm good with that. And so for me, that was like, okay. So people go, well, do you think everybody should be on this? I go, well, do you like your brain? Do you want to keep it? So, I mean, and this is not just in people who have the genetic defect. And part of the reason for that is that it's not just the genetics, it's the environmental toxins as well. And of course, you know, me, I'm defective, and all my family, and so, in fact, I go to a Rollins reunion and I go, I just want to make this real clear. If you're a Rollins, you're defective, you need my magic vitamins. And it's pretty much true, and most of them are believing me now. So what would I recommend? Well, the studies were done with just 6 milligrams of methylfolate. It comes in one pill, but it's more expensive to do it that way. You can get, if you just want the memory protection and you don't want the other benefits, you could do the half of the 15 milligram, which is pretty available. And I've put on this handout the brands that I recommend. Whenever we get something that works, then somebody makes a knockoff that doesn't work quite as well, and that's what's happened. So the reason it hasn't been easily available is because it's not very stable unless they form it into crystals. And so there's 3 different brands out there that are crystalline structure, and those work better. Now, does the other work? Yeah, it does, but not as much as the ones that are crystalline. The second thing is the methyl B12. And methyl B12 is a very complex absorption pattern. If you swallow a pill, about 1% or less absorbs. But if you'll dissolve it in your mouth, it absorbs better because it absorbs directly under the tongue rather than going through the complex absorption pattern. So while you can get it in a single pill, I think it absorbs better and works better if you put it in individual items. But if you have trouble remembering pills, taking one pill is still pretty good, still better than not taking it at all. And then the third thing is the N-acetylcysteine. And in the study that they did, they just used 1 capsule. And so that's the minimum. But what we find is this is the amino acid that helps us clear these toxins that are causing us trouble, the BPA, the heavy metals, those kinds of things. So it's also the antioxidant that keeps us from having oxidative damage to our cells. And so I like to use 2 a day rather than 1 a day as baseline. Now, N-acetylcysteine also has the effect of reducing inflammation. And so if you've got inflammation, so if I get an injury or an illness and I've got inflammation, I will go up to 3 twice a day or 3 times a day, because again, if I get too much, I pee it off. But it's relatively cheap and it does help with inflammation. And we'll talk about some of the other things it helps with, but so at least start with the minimum, and you may want to look at some of these higher doses to help with other conditions that we're talking about. Now, again, with the N-acetylcysteine, there are certain brands that I've found are better than others. Some of them you open the bottle and they smell terrible, and they don't seem to work as well. So I've listed some of those brands not because I'm endorsing them or any of that, other than the fact that these are the ones that I've known have been pretty good. So depression. So it's hard to find a good joke about depression, right? Because depression's real. And in fact, we have better evidence that depression is biochemical than we do that diabetes is biochemical. And back when I was a kid, a lot of the diabetics didn't want to let out that they had diabetes because it was viewed as a willpower problem. Well, that's how we've viewed depression for many, many years, is it's a willpower problem. If you just had the ability to pick up your bootstraps, you'd do fine. But we know that there's low levels of serotonin. We know that there's biochemical changes that are a problem. And in many respects, it is one of the most frustrating because it's the worst kind of sad, not being able to explain why you're sad. Well, why are you so sad? I don't know, I just am. And that's frustrating because you think there should be a cause. But what we've known since the 70s is that low levels of folate and low levels of B12 are associated with depression. We also have known that people with depression many times had low levels of the things that communicate between the nerves, the serotonin, the dopamine, the norepinephrine, are low. And so all of our strategies for treating depression have been around making these low levels work harder. But this is a strategy that actually has been shown to elevate the levels of serotonin, dopamine, and norepinephrine. So it will make your antidepressants work better. And many people, after they've been on it, and it takes about 4 to 6 months for those levels to get back up to normal, they can sometimes get down on their dose, get off 2 or 3 meds down to 1, and sometimes be able to get off it entirely. But my goal is not to get you off the meds. My goal is to get you feeling better, and this tends to help with that. So you do the methylfolate, the methyl B12, and then the N-acetylcysteine. And the N-acetylcysteine has been studied for decades to help with depression, with many other things, because it helps with our oxidation or stress mode within our body. So this is a biochemistry slide, and I apologize. You don't have to memorize it, but I wanted to give you a flavor for what we're talking about here. So this is the synthetic form of folic acid. This is the form of folic acid that's in our diet for the most part. And these do nothing until they can get processed clear down to here. They don't do anything in the body. And it turns out that I've got this gene defective and this gene defective and this gene defective 10 times and this one and this one. I'm really defective. Now, I have a good time at it, so I guess that counts, right? But what we got out of this big $3 billion project to identify the human genes is figured out where we can supplement and make things better. And that really is kind of what I'm talking about. So once it gets to the methylfolate, then it can get through the cells. And otherwise, you can have very, very high levels of folic acid and have very little in your cells. And then this section over here is what helps you heal. This section over here is what helps you make your serotonin, dopamine, and norepinephrine. And so I expanded that one that helps you make all of your neurotransmitters And any type of inflammation, arthritis, this thing called oxidative stress destroys the thing that helps you make all of those things, including melatonin. So many people with this tend to struggle with sleep. They can't get to sleep, they can't stay asleep, their sleep isn't restful. So if we can supplement past these blockages, we can dramatically improve people's lives. So here's what I'd start with depression. You've got the methylfolate, and again, I mentioned there's 2 that are prescription, and they cost $120 to $150 if you get it at a good price, and sometimes cost up to $400 for 3 months. So get it at a good price, okay? And you can do that with, there's some coupons. Unfortunately, insurance doesn't cover it, which is sad. Used to be we had a few insurances cover it. Now I don't think we have any at all. But there is an over-the-counter one. It's called Methyl-Life. And it's actually a person that came to my talk 12 years ago, 10 years ago. And she says, this stuff's too expensive. I'm going to start a company to make it less expensive. So there are a lot of ones out there, and most of them are made by a company that it's not as stable. This one is crystalline, and Jamie Horn has actually makes it so that I've never found anybody that sells it less per milligram. So if you want to say, well, I'm going to just do half, just do the 7.5, don't buy the 7.5s, buy the 15s and cut them in half, because they're about the same price. The second thing is this methyl B12. Now, methyl B12, again, is not as stable, and that's why they usually use the other form in treatment. So if you're getting a methyl B12 or a B12 shot once a month, you're getting cyano B12. It's not the activated form. But if you're doing the methyl B12, the injections are very light and temperature sensitive, and they're not stable for more than a couple of months. So you have to really keep those well controlled, and it's usually a shot like insulin shots, just right under the skin. But for the most part, we don't have to do those shots if we do the oral dissolving tablets. Now, again, there are a lot of oral dissolving tablets out there. The one that I found the best is Jarrow brand. And again, it's not that I own any stock in Jarrow. And in fact, we were on the Jarrow brand, and came out that there was this really inexpensive one at one of the big box stores, and I bought it up and I put my family on it, and 3 days later we switched back and I threw them away. They did not work as well. It was pretty clear. So there are some other brands that I think work, but again, I'll list the ones that I know work. You can try the other ones. Unfortunately, nobody studied it like I'd like. I'd love to get enough research money I could do more studies on this, and then I could give you better data than this. But the reality is that at least 85% of the people that I start on this, they need those first 3 things and they're good. The third thing is this N-acetylcysteine. Again, it's an amino acid. It helps with lots of things. It's been studied for amazing things like traumatic brain injury and PTSD, and they just did a study at the VA with PTSD on it, and it helped pretty dramatically. So the other things that I've found helpful, so I always start with the depression with the first 3 things. When my son got really sick, the first thing I looked for was something called BH4. And the reason it's called BH4 is some people have trouble remembering tetrahydrobiopterin. Can you imagine? I mean, it just rolls off your tongue. So, but it turns out that that was the second treatment that was approved through the FDA from the Human Genome Project. But it's real expensive because they use it for the disease called PKU, the one that they test the kids for when they're born with the heel stick thing. But they use it in super high doses. And it turns out if you take a very small dose of it, along with these other things, you can boost that BH4 pathway. And what I've found is in persistent depression, especially depression where there's been intrusive thoughts of hurting yourself, you'd be driving along and go, maybe I'll just drive off the cliff. And those thoughts are very difficult to treat, even if they're not depressed. I get people that go, yeah, I'm not depressed. I still have the intrusive thoughts. That has helped with that for a large majority. And I'll have some people take it and say, yeah, I don't notice anything. I said, well, if you don't notice anything, it's not worth taking. If you notice something, then it's worth it. And I can tell you, some people, it's like, man, I hope I never lose that because it's made such a difference. The other thing is this active form of B6 called P5P. Because if you go into the health food store and you say, I need some pyridoxal 5-phosphate, they give you a blank stare. But if you say, I need P5P, they go, oh, we got some here and here and here and here. So it's very common. Now the P5P, 25 to 50 milligrams, and most people do great with that, and you can take it long term for most people. But again, there's about 1 in 20 that on this one, they don't clear it and it can build up and cause a severe headache and that kind of stuff. So usually the way I have people take it, because again, this is all over the counter, take the B6 for a month and then go off for a month. And you'll be able to tell if you're one of the ones that's super sensitive, and then you just adjust the dose so you're taking it like a week on, 2 weeks off, or whichever. Or some people go, you know what, I feel lots better, I just stay on it. But I like you to stay with that. The other things that I've found helpful is that we need the magnesium. We also need sulfate to clear the toxins. But if you take magnesium sulfate orally, it works great for clearing your bowels out for a colonoscopy. If you soak your feet in it, it helps with pain. It actually can help with blood sugar control, but it helps absorb the magnesium and the sulfate that your body needs without making you go to the bathroom all the time. The other thing, vitamin C, we've known has been an antioxidant for decades, right? Great antioxidant, and it is. And the way it works, it regenerates glutathione. Well, if you don't make enough glutathione, which is what the N-acetylcysteine helps you do, then it doesn't work as well. It still works, but vitamin C is helpful, and I find that useful. The other thing that's important is vitamin D and omega-3s. My favorite omega-3 now is chia seeds because you don't have to grind them. Chia seeds were a number of Indian tribes' travel food because you can just put them in your mouth. Those crazy people that run 100-mile marathons, they use the chia seeds to maintain their blood sugars. But they're high protein, high omega-3s, high fiber, and they don't bump your blood sugars. So they're using them for diabetes control. You can put them in your smoothies. I do find it a little easier. So when you put them in water, they swell to 9 times their size. So they do give you a feeling of full. What I find is most people do better if they soak them and then put them in the yogurt or smoothies or whatever food they're doing. But I do eat them raw, and I keep them as my emergency food. So if I'm going, I gotta have something, I have chia seeds with me. All right, nerve pain. So nerve pain, again, is one of those things that has been a severe problem. My mother had nerve pain for decades. She never had diabetes, but she had horrible nerve pain. And I love this cartoon. You have to understand that one of the things they use to treat nerve pain is gabapentin. So hence the Fred Flintstone, if his neurotransmitters are in trouble, he'd say gabba-dabba-doo, right? Gabapentin. Well, this is an alternative to gabapentin. So the commercially available one that was tested and went through the FDA in 2006 is called Methyl. And it's a combination of the methylfolate, the methyl B12, and the B6, the pyridoxal 5-phosphate. And what they showed is that it improved not only nerve healing, but wound healing. So there's a number of wound care centers across the country that show that it works really, really well for nerve healing. And they did a study, 7 years ago now, in diabetics. And they took diabetics, they matched them and all of that. And they said, what does it cost us to treat a diabetic? And what they found was that if they added this combination, the Methyl, the methylfolate, methyl B12, and the active form of B6, if they added that to their treatment, it cut the cost of care more than $2,000 per year. Now, why the insurance companies can't figure out that this is much cheaper, and that included the cost of this vitamin. So it's more than that, because if we used it enough, then hopefully the price of the vitamin would come down. But if we can do those kinds of things, we can improve our health without expensive drugs that have a lot of side effects. So this is a slide that they showed. What happens in diabetics is the little tiny blood vessels that feed the nerves nutrition and oxygen get clotted off with diabetes, and the nerves die. Now, when I was in medical school, and I realized that's ancient history, a very long time ago, we were taught that once the nerve died, it would not regrow. And the sad part is, they still teach that in large respect today. But what they found was, if we can give the right nutrition, which is these three things. This is an ankle biopsy from somebody with diabetes with severe nerve pain. And the little purple lines are nerves. This is 6 months later, same patient, the nerves regrew. So what we were taught and what was common knowledge when I went to medical school and many, many years after is not true. Which is what we find in science all of the time. But if we can get the proper nutrition, we can get the nerves to heal. So treating with gabapentin or paragabalin, which is the Lyrica, compared to this, what they found was, first of all, people's quality of life went way up treating with this nutritional approach. But also, it not only reduced the burning, which is what your gabapentin and paragabalin do, but it decreased numbness, tingling, increased your ability to feel things, so you're no longer going around with not being able to feel if your foot got hurt. and it increased your nerve findings. And so it was something that, while it helped, it also helped reverse the disease process, which our treatments otherwise today just don't do. So for nerve pain, whether it's diabetic or not, because when I started this, I called my mom and I says, hey, I'm finding some stuff that's helping with nerve pain. Do you want to try it? And at that point, we didn't have some of these things. We were doing shots, and she says, yeah, I'll try it. She says, but you're not going to convince me to do shots. Her husband had done it. My dad had done it for decades. She says, I am not giving my shots. I am 80 years old. And I said, well, my sister's there. She'll give you the shots. And she did. She called me 4 days later, and she says, my feet don't hurt. I says, well, that's great, Mom. How long's that been? And she goes, I don't know, 30 years? I mean, she was to the point she could not walk on a bare floor without a cushion on her feet because it hurt so bad. And she says, but I'm still not doing going to give myself shots. And my sister had to go, and she was going to be gone for a week and a half, and she called me up 5 days later, and she says, can you teach me to give those shots over the phone? I said, yep, Mom, sure can. So what I recommend, again, is the methylfolate. Now, the studies, again, did about 6 to 7 milligrams. So you could do the 15 and cut it in half, and that'll save you some money. The Methyl Life is somewhere around $75 to $80 for 3 months, so you're talking about $25 a month. If you do half of that, then you're talking about $12. So it's not outrageously expensive. Then the methyl B12 that we talked about, the Jarl brand, and then the N-acetylcysteine. Well, that was not part of the original study because it's so important at getting rid of these toxins that we know cause diabetes and know cause a lot of this nerve dysfunction. I always add that in. It's my favorite. And then the vitamin B6, and that again can be 25 to 50 milligrams a day. And I usually will do it either a week on, a week off, or a month on, a month off, and just see how people respond to it. Wound healing and other stuff. So I wanted to go over, my kids love the, it's just a flesh wound. Sorry. I'm bad and I know it, but I have a good time. So what they showed in Wound Magazine back in 2006, this is part of what it got approved with, is that if you do this combination of vitamins, it speeds the wound healing. Whether it's from some surgeon deciding to cut on you, those darn surgeons, or injury or muscle strain, whatever. It also helps with traumatic brain injury. The other study that I find fascinating is the Marine Corps said, we think this will help with hearing loss. Okay? For some reason they have loud noises in the Marine Corps, you know? So they did this study where they get one barracks, they put N-acetylcysteine in their drink, and the other barracks they didn't, and showed that it improved the hearing protection as good as the hearing muffs. But then when they went to publish it, they said, so did you get consent from the Marine Corps? Well, yeah, like we do everything else in the military. All right, you've just consented to do this. So then they had to go redo the study and have them actually sign a piece of paper saying that they consented. But it was a fascinating study showing it protected hearing. It also, there's studies showing it protects against radiation damage. So if you're exposed to ionizing radiation, like being a pilot that flies at 40,000 feet, you're exposed to quite a bit of radiation. Not that we have any radiation around here, so. And then the other more recent study, 2016 study at the VA, where they showed that it dramatically improved the PTSD symptoms. And I'm like, wow, I like that. So the other things that it's been shown to help with is addictions. Bipolar, it's got level A evidence. It's got better evidence than many of our bipolar meds with almost no side effects. Now, some of the universities are using this as their primary treatment for bipolar because people will take it because they don't stop it because the side effects are horrible. Helps with epilepsy. The other one that's fascinating, it's the only thing in medicine, this N-acetylcysteine, that has helped with hair twirling, nail biting, and skin picking. I've had people that have done the hair twirling for 50 years, and in 2 weeks on NAC, gone. So fibromyalgia, chronic fatigue, ADHD, migraines, inflammation, OCD. I mean, it's just lots of stuff. Now, I want to go over a couple of environmental things that actually came out in 2009 in the President's Cancer Panel. It says, what can individuals do to reduce the risk of cancer? Well, first is filter their water. And you want a multi-stage filter. RO, I think, the reverse osmosis, I think, is the best. But you can get a countertop water filter that'll do something like 2,000 gallons for $120. So it doesn't have to be expensive. Put it in stainless steel or glass because the BPA is a problem. They recommended not to drink out of water bottles at all. To take your shoes off when you go in your house. Why? Well, it turns out that when you walk around, you pick up pesticides from us trying to keep the weeds down. And then you walk across your carpet, then you take your shoes off and walk across the carpet and they absorb up through your skin. Wash your fruits and vegetables, reduce pesticide exposure. I mentioned the BPA, the plastic stuff. So you don't want to microwave in plastic. You want to be microwaving in ceramic. And then the other thing that wasn't in the cancers panel, but they've used for decades, is for removing some of these toxins, you can use a volcanic rock called zeolite. It's pulverized volcanic rock. When we had Chernobyl, and I don't even have to explain that to you folks because all the young kids are like, what's that? So when they had the reactor blow up and they had all of these kids exposed to radioactive cesium, they made cookies with this pulverized volcanic rock, and one treatment cleared 1/3 of the radioactive cesium. I mean, it's a great study, unethical to do it on purpose, but a great study. And it's been used in cleanup for years. In the 70s, they noticed that when we remodeled our houses and buildings and put in new carpet, we'd get this great new carpet smell that would make a bunch of people sick, called sick building syndrome. And in the 70s, the recommendation was to take this zeolite, spread it out over the carpet. They said 4 hours, but I do 8 hours. Go back through and vacuum it up with a HEPA filter, and it clears it out. And that's been in the literature since the 70s. So then the other thing is this process boosts your ability to clear toxins. So that's some of my information, and was all I thought I could get through in the time they gave me because it's overwhelming. There's a lot of information here, and I know that. But takeaway, methylfolate, methyl B12, N-acetylcysteine, I get to keep my brain. So I'm happy to open it to questions. I don't know if you wanted to do anything before questions.
No, if you just want to
I will try and repeat the question so that they can record it. So the question is, how about Prevagen? So Prevagen has some data to show that it preserves memory. Now, the way we think it works is different than the way this works, so I would do them, and in fact I have people doing both, this combination and Prevagen. But I have been impressed that the Prevagen data is pretty good. So the question is, with shingles, 1, it's not fun. 2, afterwards you have a lot of nerve pain, itching, that kind of thing. First of all, the way your body shuts down viruses and bacteria is this pathway. So methylfolate, methyl B12 will help you shut down viruses and bacteria and make your illness duration shorter, and it helps with the nerve healing at the end. So it should have helped both with shortening the acute phase of the shingles and shortening the post-shingles nerve pain. Yeah, yes. So the question is regarding herpes simplex virus, which is actually similar to the shingles. It's a similar type of virus. These viruses, all of these viruses are shut down by this combination. Part of the reason why when you're sick that it takes you a long time to recover is it depletes your body entirely of the methylfolate. So when I get sick, I take extra. But I don't take it at night because the methylfolate I use to help with fatigue. Because it gives you, most people, gives you energy for 6 to 8 hours a day. So sometimes with chronic fatigue, I'll do 1/2 or 1 in the morning, 1/2 and 1 at noon, not in the evening. Yes?
Does the methylfolate...
So methylfolate, when it first came out, the question was drug interactions. When it first came out, they said there's no drug interactions. And then they said, well, in first generation anti-seizure drugs, it can affect the levels a little bit. Well, we don't use first generation anti-seizure drugs for the most part. And so it really has very, very little drug interactions. It does tend to help your medications work better, especially those that are related to nerves. And so some people are able to reduce their dose, but wouldn't do that on your own. Work with your doc and say, man, I'm feeling better. Can we cut this back? So the question is, what about Alzheimer's? And Alzheimer's is a devastating disorder. Lost my father-in-law to it. And I wish that I could tell you that I've figured it out. Okay? I don't. But when they started the studies on memory, they did it first on age-related memory loss, which is a very common thing. But then they actually showed that this combination early on will delay Alzheimer's as well. So it's not the only treatment, but really our treatments for Alzheimer's delay onset of symptoms by 6 months. They don't prevent it. This has been shown for long-term prevention. That was what was fascinating about this vitamin cognition study, the VitaCog study, is that it showed that we could preserve the nerves. And that is key. That's huge. Yes? Is hearing loss repairable? So the question is hearing loss repairable? So the question is, which kind of hearing loss? So it turns out that there are lots of different kinds of hearing loss, but some of the hearing loss is nerve damage, and this has been shown to improve I've seen it improve Meniere's disease. I've seen it improve hearing loss. Although I had one relative that they didn't really want that because they would just turn off their hearing aids when their wife was yelling at them. But I have seen it help with hearing loss. Is it a cure-all? I'm sure it's not, because hearing is a multifunction thing, but I've seen it dramatically improve a number of hearing and inner ear problems. So the question is, on the chia seeds, how much? Well, I try and do a teaspoon twice a day, but again, there's not a lot of data, and if you're using that as your main food, the other reason why I like chia seeds is I haven't found anybody allergic to them. I'm sure somebody out there is, but for people, we have people now who are sensitive to virtually everything. So what do you store in an emergency? What do you keep in your car for an emergency for somebody who can't eat hardly anything at all? And what I've found is chia seeds works pretty well. And so in that situation, if it's your life-sustaining thing, you may need to go to a tablespoon twice a day or 3 times a day. Yes? So the question is, where do you get chia seeds? Well, used to be it was really expensive. It was like $12 to $15 a pound. Costco has them now. I buy them from this guy that imports a shipload of chia seeds and buy them in 50-kilogram bags and put them in cans. But that's hard to get to, and my sister has to buy them for me because it's not in our area. But Costco now has them. They're coming down to about $3 or $4 a pound. So the question is, what about sciatic nerve pain? So again, it's multifunctional, so multi-causes. If your nerve is being squeezed by a herniated disc, it's probably not going to solve that. But it does help with nerve healing. So I've had some people, it's helped them well enough, they haven't needed surgery with the sciatic pain. It's at least worth a try, but it may help with healing after surgery. So, yes?
What about trigeminal neuralgia?
So again, the question's, what about trigeminal neuralgia? That is a nerve that gets inflamed, and since N-acetylcysteine helps with inflammation, and these other two help with nerve healing, I have seen it help with the trigeminal neuralgia. In the back there. So the question is on statins and some of the memory-lowering drugs. Statins can cause loss of memory. And so if you're struggling with your memory, it may be worth discussing with your doctor about a trial off of it and see if it helps. There's some cholesterol chelator drugs like cholestyramine and Westcol. Because they're cholesterol lowering drugs, they list it as causing memory loss, but as far as I know, they don't by themselves cause memory loss. But again, if you're struggling with your memory, it's worth going off at a month or two and saying, gosh, is this doing me more harm than good? That's like every other medicine that we take. Sometimes it's doing me more harm than good. Yes? So the question is, if you're eating lots of berries, do you do the chia instead of or in addition to? So I didn't mention this, but it turns out that the one group of foods that has methyl folate in it naturally is berries. But berries and chia seeds have different nutrient values, so I would try and do both, because the berries don't have the omega-3s, and so or as much, and so I think it's worth doing both, and they both are valuable. So yes. So the question is, if you wake up in the morning and your fingers are cold, they're outside the covers and they tingle, that is a nerve problem. This may help it. It may, some people get pain in their fingers and they get real white. They actually have some gloves that have infrared fabric in them that help that as well. So there's a lot of things out there. Again, this is not I'm giving you all of the wonderful information that you never need to know anything else, but it's some stuff that has really helped tens of thousands of people that I know of, and I think it'll help. So I think she's telling me I'm done.
I tell you, we could stay listen to him forever. Could we?
You're welcome.